Heart attack mortality rate and early warning signs. According to a 2023 report by the World Health Organization, WHO, approximately one-third of heart attack patients die before reaching the hospital. This statistic highlights the seriousness of the condition and emphasizes the importance of recognizing early warning signs to ensure timely medical intervention. Even within the first 30 days after a heart attack, the mortality rate remains high, ranging between 10 to 15%, despite hospitalization and medical treatment. This is a critical period that requires strict adherence to treatment protocols and close monitoring to reduce risks. However, there is some good news. If a patient receives immediate and appropriate emergency care, the survival rate can reach up to 90%. This underscores the life-saving importance of early symptom recognition, calling emergency services immediately, and seeking prompt medical attention. Now, let's explore the 10 early warning signs of a heart attack. If you find this information valuable, like, share, and comment to help spread awareness. Subscribe now so you don't miss out on essential health insights. Severe chest pain, the most critical early warning sign. Severe chest pain is the most distinctive and common symptom of a heart attack, and recognizing it early can be crucial for timely intervention. This is a key warning sign that can help detect acute myocardial infarction and prevent life-threatening complications. The pain typically occurs in the center of the chest or slightly to the left, just behind the sternum. In some cases, it can radiate to the shoulders, arms, especially the left arm, back, neck, jaw, or even the upper abdomen. Patients often describe it as a squeezing, crushing, or tightening sensation. Some compare it to a heavy weight pressing on their chest rather than sharp, stabbing, or mild discomfort. The pain can last between 5 to 30 minutes, may disappear and return, but does not subside with rest or position changes. In some cases, taking nitroglycerin, a vasodilator, may provide relief, but persistent pain despite medication strongly indicates an acute heart attack. The intensity of pain can range from moderate to severe, often causing extreme discomfort. Notably, in women, the elderly, or diabetic patients, the pain may be milder or less apparent, but it still causes a sense of discomfort in the chest, making early recognition more challenging in these groups. If chest pain lasts longer than 5 minutes, is accompanied by a squeezing, heavy, or tightening sensation in the center of the chest, does not subside with rest or water intake, and radiates to the shoulders, arms, neck, or jaw, seek emergency medical help immediately. Even if the pain temporarily disappears and returns, do not ignore it. Quick medical intervention is crucial to prevent severe consequences. Shortness of breath, a key symptom in certain high-risk groups. Shortness of breath can be a primary symptom of a heart attack, particularly in women, the elderly, and diabetic patients, even when chest pain is absent. This makes early recognition more challenging for these groups, increasing the risk of delayed treatment. Shortness of breath can manifest in various ways. Some individuals struggle to take deep breaths, feeling as though they are not getting enough air into their lungs. Others experience sudden breathlessness or rapid breathing, even without any physical exertion. Some patients describe their breathing as shallow and fast, similar to feeling out of breath after running, despite sitting or lying still. Additionally, some may feel a heavy pressure on the chest, making it even harder to breathe. In more severe cases, this condition worsens when lying down, forcing the patient to sit upright to breathe more easily. Shortness of breath can occur under different circumstances. It may develop suddenly or gradually, and it is not necessarily linked to physical activity. More importantly, it can happen even while resting or without any prior exertion. In some cases, this symptom may be accompanied by a dry cough or frothy sputum, especially if the heart attack has led to acute heart failure. Another notable warning sign is worsening shortness of breath when lying flat, which can indicate heart failure triggered by a heart attack. If severe shortness of breath occurs, emergency medical attention is urgently required if the patient experiences sudden breathlessness, struggles to take deep breaths despite being at rest, or finds breathing increasingly difficult when lying down, only improving when sitting up. Additionally, if bluish lips or pale skin are present, it indicates severe oxygen deprivation. Most critically, if the patient is unable to speak or loses consciousness, immediate CPR, cardiopulmonary resuscitation, should be performed while waiting for emergency responders. Radiating pain, a distinctive indicator of a heart attack. Pain that spreads to the shoulders, arms, or neck is a classic symptom that helps distinguish a heart attack from other causes of chest pain, allowing for timely medical intervention. The pain usually originates in the center of the chest or behind the sternum, then extends to various other regions. The most commonly affected areas include the left shoulder and left arm, particularly along the inner side of the arm, reaching down to the pinky and ring fingers. Some patients may also feel pain radiating to the neck and lower jaw, sometimes leading to misdiagnosis as dental pain. Others may experience pain in the upper back or shoulder blades, and although less common, the pain can spread to the right shoulder or right arm. The nature of the pain is often described as constricting, crushing, or tightening, rather than sharp or stabbing. Many patients also report a tingling or weakness in the left arm, which may make movement difficult. A crucial distinguishing factor is that changing posture does not alleviate the pain, helping differentiate cardiac pain from musculoskeletal pain. The duration of the pain is another critical factor in assessing its severity. It may last from a few minutes to several hours, may come and go, but does not improve with rest or drinking water. If the pain persists for more than 15 minutes, the likelihood of a heart attack is extremely high, and immediate emergency intervention is necessary. If the pain radiates to the shoulders, arms, or neck, particularly if it originates in the chest and spreads outward, does not improve with position changes or massage, and is accompanied by numbness or heaviness in the arm, seek emergency medical assistance immediately. A critical warning sign is radiating pain without any previous injury, as this could indicate a blocked coronary artery, a life-threatening condition that requires urgent medical attention. Cold sweats, a critical sign of an acute heart attack. Cold sweats are a significant warning symptom of an acute heart attack, which can occur before, during, or after the onset of chest pain. This is a serious emergency warning, but is often overlooked, especially in women, the elderly, and diabetic patients. Recognizing this symptom early allows for timely medical intervention, reducing the risk of life-threatening complications. Abnormal cold sweats can manifest in various ways. Many patients describe sudden sweating, even when they are not physically active or in a hot environment. The sweat is often cold, clammy, and sticky, and it can spread across the entire body or be localized to specific areas such as the face, hands, or back. A crucial point to note is that this sweating is unrelated to weather conditions or regular stress, leading many people to dismiss it as insignificant. In some cases, cold sweats may be accompanied by restlessness, panic, or an overwhelming sense of impending doom, indicating a more severe underlying condition. The intensity of cold sweats can vary. Some individuals may only notice mild dampness on their forehead, neck, or palms, while others break out in a full-body sweat, drenching their clothes for no apparent reason. More concerning is when the sweating does not subside, even after resting or drinking water, suggesting a serious cardiac issue. Unusual cold sweats should never be ignored, especially if they occur suddenly without physical exertion or high temperatures, and are accompanied by feelings of anxiety, uneasiness, or extreme fatigue. If the symptom persists despite resting, call emergency medical services immediately for prompt evaluation and treatment. Most critically, if cold sweats occur alongside chest pain or shortness of breath, the likelihood of a heart attack is extremely high, requiring urgent medical intervention to prevent severe complications. Dizziness and loss of balance, a common yet overlooked danger. Dizziness or loss of balance can be a serious yet often disregarded symptom, as it may be mistaken for other non-cardiac conditions. This leads patients to underestimate its severity, potentially delaying life-saving treatment. Dizziness can manifest in various ways. Some individuals experience sudden lightheadedness or disorientation, while others describe the sensation as feeling faint or on the verge of passing out. Some cases involve loss of balance, unsteady walking, or a sensation similar to motion sickness, seasickness, even while remaining still. Notably, dizziness can occur even when sitting or lying down, not just when standing or moving. The condition tends to worsen when standing up suddenly, a phenomenon commonly seen in people with postural hypotension, low blood pressure when changing positions. In certain cases, dizziness is accompanied by temporary blurred vision, further impairing coordination and awareness. The duration of dizziness is another important factor. It may last only a few seconds or persist for several minutes, but what is particularly concerning is when it does not improve with rest or position changes. If dizziness continues to recur or progressively worsens, it may indicate a severe underlying issue, such as an abnormal heart rhythm, arrhythmia, or acute heart failure. If dizziness becomes severe or leads to near fainting, emergency medical assistance is immediately necessary if the patient loses balance significantly, is unable to stand or walk properly, experiences brief unconsciousness, or actually faints. Most concerningly, if dizziness occurs alongside chest pain, shortness of breath, or an unusually rapid heartbeat, it could signal a life-threatening cardiac arrhythmia or cardiogenic shock, requiring urgent intervention to prevent fatal consequences. Nausea or vomiting, a commonly misinterpreted warning sign. Nausea or vomiting is a frequently overlooked symptom of a heart attack, as it is often mistaken for digestive issues such as acid reflux, food poisoning, or gastritis. Many individuals dismiss it as a minor stomach problem without realizing that it may be linked to a serious cardiac event. Correctly identifying the nature of this symptom is crucial for early detection and timely intervention. Nausea can manifest in various ways. In some cases, it occurs suddenly, without an obvious cause, unrelated to food intake or digestive disturbances. Some people may experience persistent nausea or even vomiting that does not improve with drinking water or resting. This symptom can sometimes be accompanied by chest pain, but in other cases, nausea appears alone with no chest discomfort. Many patients also report experiencing cold sweats, dizziness, or shortness of breath, which further increases the severity of their condition. The duration of nausea is another important factor to consider. It can last from a few minutes to several hours, appearing suddenly or in intermittent waves. A particularly concerning sign is when nausea does not improve even with anti-nausea medication, suggesting that the cause may be more serious than common digestive issues. If nausea or vomiting occurs without an apparent cause, especially when accompanied by chest pain, shortness of breath, or cold sweats, emergency medical attention should be sought immediately. This symptom becomes even more alarming if it is not linked to food intake or digestive problems and does not subside with anti-nausea medication. When nausea occurs alongside other warning signs of a heart attack, immediate medical intervention is essential to prevent severe complications. Sudden anxiety or unexplained panic attacks. Some heart attack patients do not experience classic chest pain, but instead they report a sudden and overwhelming sense of anxiety or panic, as if they are about to die for no apparent reason. This symptom is frequently misinterpreted as a panic attack due to anxiety disorders, leading many to underestimate its true severity. This unexplained anxiety can manifest in different ways. For some individuals, the sensation strikes suddenly without any identifiable trigger. They may experience intense fear, extreme nervousness, or a sense of impending doom, sometimes to the extent that they cannot control their emotions. Some patients describe it as a feeling that something terrible is about to happen, yet they cannot explain why. Along with these feelings, they may also experience restlessness, discomfort, and an inability to stay still, which can intensify the sensation of panic. The duration of this symptom varies. Some people experience brief episodes of anxiety lasting only a few minutes, while others feel continuously on edge for extended periods without relief. Most concerningly, this can be an early warning sign occurring days before an actual heart attack, but because it is not immediately linked to cardiac symptoms, it is often ignored or misdiagnosed. If someone experiences extreme anxiety or a sudden panic attack without a clear cause, particularly if it is accompanied by rapid heartbeat, cold sweats, shortness of breath, or chest pain, they should seek emergency medical attention immediately. The key distinction is that this symptom does not stem from previous stress or psychological triggers, setting it apart from typical panic attacks. This symptom is especially common in women and can often be one of the earliest indicators of a heart attack. Recognizing and addressing it promptly can be life-saving, helping to prevent dangerous complications associated with delayed diagnosis and treatment. Unexplained fatigue, a silent warning, sign of a heart attack. Unexplained fatigue is a common but often overlooked symptom of a heart attack. It can appear days or even weeks before a cardiac event, or it may occur suddenly during an acute heart attack, making it difficult for many people to recognize its true severity. Fatigue can present in various ways. Some patients describe feeling extremely exhausted or weak, even without an obvious reason. Others find that they struggle to complete everyday tasks that they previously handled with ease. Particularly concerning is when fatigue sets in even without much physical exertion, making individuals feel that something is off, yet they fail to associate it with a potential heart problem. This symptom can last for several hours or even days, forcing individuals to rest more than usual, but even with adequate sleep, they do not feel any better. The onset of fatigue varies among individuals. Some experience gradual, worsening fatigue over several days, while others suddenly feel completely drained without any warning signs. The most concerning aspect is when rest does not improve the exhaustion, which may indicate that the heart is struggling to pump enough blood to vital organs. In cases of extreme fatigue, especially when an individual cannot perform routine activities or experiences sudden, severe exhaustion without an identifiable cause, emergency medical attention is necessary. Even more concerning is when fatigue persists for hours or days without improvement, as this significantly increases the likelihood of a heart attack. If fatigue is accompanied by shortness of breath, chest pain, or dizziness, it may be a sign of heart failure or compromised cardiac function, requiring urgent medical intervention to prevent severe complications. Rapid or irregular heartbeat, a sign of potential cardiac distress. A rapid or irregular heartbeat can be another critical warning sign of a heart attack. This symptom often comes with sensations of palpitations, skipped beats, a racing heart, or breathlessness, making individuals feel uneasy. However, many people dismiss these signs, assuming they are just temporary reactions to stress or anxiety. Heart palpitations can manifest in various ways. Some individuals experience a sudden increase in heart rate, exceeding 100 beats per minute while at rest. Others describe a forceful pounding sensation in the chest or feel as though their heart is skipping beats or beating irregularly. Some cases involve a fluttering or racing sensation in the chest that feels out of control. These symptoms can also be accompanied by nervousness, restlessness, or a sense of fear, further increasing emotional distress. The duration of abnormal heart rhythms varies. Some individuals experience brief episodes lasting only a few seconds or minutes, while others endure prolonged episodes that intensify over time. The key concern is that these symptoms do not subside with rest or position changes, strongly suggesting that the cause is cardiac-related rather than a benign condition. If a person experiences a rapid or irregular heartbeat, exceeding 100 beats per minute while at rest, or feels their heart skipping beats or beating erratically, immediate medical attention is required. This is especially urgent if the symptom is accompanied by dizziness, chest pain, or shortness of breath, as it could indicate a serious arrhythmia, irregular heart rhythm. If the heartbeat becomes too fast, too slow, or is accompanied by fainting, this may signal a dangerous cardiac event that requires urgent medical intervention to prevent life-threatening complications. Indigestion or heartburn, an often overlooked warning sign of a heart attack. Indigestion or heartburn is a commonly ignored or misdiagnosed symptom, often mistaken for gastric issues such as acid reflux, food intolerance, or gastritis. However, in many cases, it can actually be an early warning sign of a heart attack. This symptom is particularly common in women, the elderly, and diabetic patients, who often experience atypical heart attack symptoms, making early recognition more challenging. Indigestion can manifest in various ways. Some patients describe a burning sensation in the chest or upper abdomen, specifically in the area just above the navel and below the sternum. Others experience discomfort or dull pain in the upper stomach, which may sometimes radiate to the chest or back, making it easy to mistake for digestive problems. Additional symptoms may include bloating, a feeling of fullness, or discomfort, even without eating large meals. Some individuals may also report heartburn, a sour taste in the mouth, or acid reflux, which does not improve with antacid medications. In certain cases, nausea may also be present, with or without actual vomiting. The duration of this symptom varies widely. It may occur in episodes or persist continuously for several hours and often has no clear connection to meals. The most concerning sign is when indigestion does not improve with common acid reflux medications, suggesting that the cause may be cardiac rather than gastrointestinal. If indigestion or heartburn does not improve despite taking medication, especially when accompanied by chest pain, shortness of breath, or cold sweats. Emergency medical attention is necessary. A major concern is that a burning sensation in the chest may be mistaken for acid reflux, when in reality it could be a heart attack in progress. If indigestion or heartburn occurs alongside other cardiac symptoms, do not ignore it. Seeking medical evaluation immediately can prevent life-threatening complications. 5 foods that help reduce the risk of heart disease. According to numerous nutritional studies, certain foods can support heart health by positively impacting blood pressure, cholesterol levels, and overall circulation. Incorporating these foods into a daily diet can help lower the risk of heart disease and improve long-term well-being. Fatty fish, salmon, sardines, mackerel, tuna. Fatty fish are rich in omega-3 fatty acids, which help reduce inflammation, lower blood pressure, and prevent arterial plaque buildup. Omega-3s also promote heart rhythm stability, decreasing the risk of heart attacks and strokes, especially when consumed in moderate and consistent amounts. Nuts, walnuts, almonds, flax seeds, chia seeds. Nuts provide healthy fats, magnesium, and fiber, which help lower bad cholesterol, LDL, increase good cholesterol, HDL, and improve blood vessel function. Regular consumption of nuts can also reduce inflammation and stabilize blood pressure. 2 key factors in heart disease prevention. Citrus fruits, oranges, tangerines, grapefruits, lemons. Citrus fruits contain flavonoids, a group of anti-inflammatory compounds that help improve circulation and lower blood pressure. Additionally, their high fiber and vitamin C content strengthens the immune system and reduces the risk of arterial plaque formation, offering significant heart protection. Dark leafy greens, spinach, broccoli, kale. Dark leafy greens are packed with antioxidants and nitrates, which help dilate blood vessels, lower blood pressure, and prevent arterial stiffening. They also provide folate and potassium, 2 essential nutrients that support heart function and regulate blood pressure levels. Whole grains, oats, barley, brown rice, whole wheat bread. Whole grains are an excellent source of soluble fiber, which helps reduce cholesterol absorption into the bloodstream and lowers the risk of heart disease. These grains also help stabilize blood sugar levels, increase satiety, and improve vascular health, ensuring the heart functions efficiently. Maintaining a balanced diet rich in heart-healthy foods combined with a healthy lifestyle that includes regular exercise, stress management, and sufficient sleep plays a crucial role in reducing the risk of heart disease and promoting long-term cardiovascular health. Recognizing the early signs of a heart attack can save lives. Identifying early heart attack symptoms can save your life or that of a loved one. Do not ignore warning signs such as chest pain, shortness of breath, persistent fatigue, or cold sweats. Each of these symptoms could be a critical alert from your heart. If you found this information helpful, make sure to like, share, and comment to help spread awareness. Subscribe now to stay updated with more essential health knowledge. Stay tuned for our next video where we'll explore even more ways to protect your heart.